Tuesday morning, the doctor called me and said that my mom's test had come back positive and she was declining really quickly.
We need to put an iron ring around our seniors and other vulnerable populations.
The Premier's message about protecting seniors comes as we learn details behind a deadly COVID-19 outbreak at an Ontario nursing home. Good evening, I'm Dwight Drummond. I want to welcome our viewers in Windsor and, of course, here in Toronto and right across the GTA. There is growing unease tonight about what is happening inside a long-term nursing home northeast of the city. COVID-19 is believed to be behind the deaths of 9 residents of the Crest nursing home in Bobcaygeon near Peterborough. This has left staff and other residents of the home and their families worried about what will happen in the coming days. Lisa Shing now with the latest.
The small community of Bobcaygeon is reeling today after 9 residents and 1 volunteer died at Pinecrest Nursing Home in Cottage Country. That volunteer was Jean Pollock, whose husband is a resident there.
Before we left, they held the phone to her ear and she was on oxygen, but she could still talk. Yeah, she was pretty afraid.
Pollock's daughter Pam drove from Vancouver when she heard her mom was sick, but didn't make it in time. Her mom died Saturday.
She said, "I'm going downhill quick." So I told her that I loved her and,
My mom and dad moved up here.
Ian Hanscombe's father is also in Pinecrest, but doesn't have symptoms.
The anxiety of waiting and the feeling of helplessness. It's a situation that we've all been put in. The unknown. How long is this going to last?
We've also learned a second resident at Hillsdale Terraces in Oshawa has died. Last week, several people there tested positive for COVID-19.
We're putting an iron ring of protection around our seniors.
Ontario's Premier announced new measures from health officials, prioritizing testing for those patients and suggesting anyone over 70 should self-isolate, which means only essential visitors are allowed in long-term care homes.
I know it's hard not being able to visit loved ones, but it's the only way to protect them.
The province says it's also increasing screening at the homes and implementing stricter rules around self-isolation for staff, volunteers, and new residents.
Will it happen more often? Absolutely, it will. That breaks my heart.
Some experts say they'd like to see more widespread testing. Right now, if 2 or 3 people test positive in a home, it's assumed everyone who has symptoms has it.
Instead of just testing 1 or 2 people and then assuming that we know who's sick and who isn't, we probably should be testing everybody, including visitors and all staff.
That's because people in these homes may not recognize they have the symptoms. There's also more and more evidence those who are asymptomatic can transmit the virus. Now, I asked Ontario's top doctors whether they plan on testing more widely. They say it's something they're considering. Lisa Shing, CBC News, Toronto.
33 people have now died from COVID-19 in Ontario, and CBC News has learned that more than 430 intensive care patients in this province are confirmed or suspected to have the disease. It's a number far higher than officials have revealed recently, and the information comes from provincial reports that have not been made public but were obtained by CBC. Queen's Park reporter Mike Crawley now with the exclusive details.
The first place where hospitals get overwhelmed by COVID-19 patients is in intensive care. The virus spread so quickly in northern Italy that ICUs like this one were swamped with more patients than beds. That's why here in Ontario, health officials are closely watching how many cases of COVID-19 are coming to the intensive care wards.
At this point, we're aware of 63 patients with COVID-19 who are in an ICU.
That was Saturday, but CBC News has learned the number of suspected cases is far higher. Over the past week, the number of confirmed COVID-19 patients in ICU grew sharply and hit 92 on the weekend. Hospitals class hundreds more ICU patients as suspected of having the coronavirus. They just haven't received test results yet.
But we also have a list of suspected cases that are being dealt with in the hospitals as if they were active COVID-19 cases. We want to make sure that the same precautions are taken until the test results come back.
So why aren't test results back yet for those 300 plus suspected cases? These patients are all showing symptoms of COVID-19 and are sick enough to be in intensive care.
It does puzzle me a bit because we are prioritizing those ones.
Public Health Ontario says it can turn around test results for priority cases in 24 hours.
I am not sure why they're not moving those through to confirm or rule out as quickly as they can.
Meanwhile, medical staff who work in ICUs are bracing for a possible surge in new patients.
And the nursing colleagues and RT colleagues and all of the clinical team who work there are anxious for sure. A bit scary. We don't know what this is like yet.
There are roughly 2,000 intensive care beds around Ontario. Right now, a little more than 1,500 of them are occupied, and more than a quarter of those patients are suspected or confirmed to have COVID-19. Will those beds be enough?
I think it's all about the trajectory. So how quickly can we turn that and stretch out the curve? If we can do that, then I'm feeling more confident.
Late this afternoon, officials announced the number of confirmed cases in Ontario ICUs has hit 100. Experts say that what happens with ICU admissions over the next week or two will tell us whether the physical distancing measures that were imposed in mid-March were enough to stop what happened in Italy from happening here. Mike Crawley, CBC News, Toronto.
We were having some technical difficulties. I no longer need the glasses. In Toronto, there are 591 cases with 30 patients in the ICU. Now, today, health officials confirmed there are a number of positive COVID-19 cases in our own backyard.
We recently learned that some of my colleagues from my very own team at one of our Toronto Public Health main offices, located at 277 Victoria Street, contracted COVID-19. Given that COVID-19 is spreading in our community, we were prepared for this unfortunate situation.
Currently, there are 8 Toronto Public Health staff who have tested positive for the virus. All are at home self-isolating, and anyone who has been in contact with the individuals have been notified. Now, most TPH staff are working from home as a precaution, and those that are not are now wearing protective gear. There are also about 12 doctors, 13 nurses, and 6 other staff that have tested positive for COVID-19 in Toronto. Canada's Chief Medical Officer of Health says this week will be very important to finding out if we have been able to flatten the curve. Dr. Teresa Tam says physical distancing guidelines must be adhered to, especially with several religious holidays coming up,
including Easter, Passover, Vaisakhi, and Ramadan. Now is the time when all assembly needs to happen virtually. Prepare ahead to connect through social media and over the phone and internet.
The City of Toronto closed all parks and recreational facilities last week, but that didn't stop groups from gathering and enjoying the weather this weekend. There were pictures posted on social media of people in parks playing soccer and using exercise equipment. Now, the city is ramping up efforts to keep people home. Greg Ross with more on the pricey fines you could face.
People were playing soccer at the Weston Lions Park and at Humberline Park, having climbed over fences and gates that were locked there to keep people out during this health emergency.
The mayor was clearly frustrated today over the fact that people are still not complying with the city's decision to close all parks to help stop the spread of COVID-19.
I'm just out at the park with my dog. Other than that, we don't go anywhere else.
This off-leash area at Stanley Park was empty today with padlocks on the gates, but that didn't stop these dog owners from using an adjacent baseball diamond as an impromptu off-leash area.
She's a big dog. I can't keep her at home.
She may want to rethink that because this week the city is planning to ramp up efforts to keep people away from parks.
Our bylaw enforcement officers working together with police, working together with our parks ambassadors, going to these hotspot parks where we have seen activity.
City spokesperson Brad Ross says the plan is to educate people on why it's important to stay home, and if they still don't comply, the police will be standing by ready to take action.
Enforcement can range from tickets to summons to even criminal charges if they're appropriate.
The set fine is $750. It could go as high as $5,000.
If you're out there playing soccer, you're out there playing basketball, you're out there partying, it's your own fault.
This man who lives in City Place says it's about time. He says people have been using the park across from his building all week.
It's just frustrating because we're all trying to do our part.
Greg Ross, CBC News, Toronto.
They are our heroes on the front lines. Still ahead, the start of a new series shining spotlight on the people who are going above and beyond to help others in the fight against the coronavirus. Air Canada says it's going to temporarily lay off more than 15,000 of its unionized workers. The airline also announced plans to cut between 85% and 90% of flights, including most of its U.S. and international routes. The aviation industry is one of many around the world struggling to deal with the impact of the COVID-19 pandemic. The layoffs, which will extend through April and May, will also affect about a third of management, administrative, and support staff. Ottawa's 75% wage subsidy program to help companies pay salaries during the crisis will cover more than just small and mid-sized businesses. Prime Minister Justin Trudeau said today that anyone whose business revenue decreased by at least 30% due to the coronavirus qualifies. But Trudeau says the government is counting on businesses to act in good faith and not misuse federal assistance meant to go to workers.
Every business of every size is having to make some difficult decisions because of COVID-19, and that's why the number of employees is not the eligibility criteria we've chosen. If you think this is a system you can take advantage of or game, don't. There will be serious consequences for those who do.
The subsidy means Ottawa will cover a worker's salary by up to $847 per week, backdated to mid-March. The assistance will be available whether a business has 10 workers or 1,000. It applies to charities and nonprofit organizations as well. Deputy Prime Minister Chrystia Freeland admitted today problems with people trying to access financial assistance, and that's before a new benefit begins.
And I do want to say to all the Canadians who need access to these programs, we get it. I really apologize sincerely for some of the kinks in the delivery of these programs, but I want to assure people we are working 24/7 to get that support out to Canadians.
Online access to the Canadian Emergency Response Benefit is supposed to be available next week. Other ministers also attended today's briefing, including Defense Minister Harjit Sajjan. He says so far there has been no request from the provinces and territories for military assistance in this crisis. But he says forces personnel remain ready to respond to any and all emergency needs should they come up. 4 people have died of COVID-19 in the Sarnia-Lambton area, 3 of them at a seniors' home in Sarnia. CBC Windsor host Chris Ensing joins us now. And Chris, what are officials saying there tonight?
Well, they're trying to slow an outbreak at Landmark Village's senior home. Now, Lambton Health is dealing with about 30 positive COVID-19 cases, 4 deaths, and that's a jump from last week where they didn't have any cases at all. Here's what we can tell you. Again, 4 people have died because of COVID-19 in the Sarnia-Lambton area. 3 of them were at Landmark Village Seniors Home. Now, that's a place with 123 different rooms. Some of those positive tests came after those people had died. And the medical officer of health out there says that the cases are linked to group travel to Europe, faith community gatherings, and family gatherings. Now, this is a story that we're following closely as we continue to watch the spread of COVID-19 in southwestern Ontario. Here in Windsor, Essex, our cases nearly doubled. We have 44 positive COVID cases, and that's after we've seen the dramatic spike across the river in Detroit. It's a hot spot, one of the priority zones as the United States battles COVID-19. It's also something all of us are watching closely because of the healthcare workers that go back and forth. There's about 1,500 people who work on that side of the border but live in Windsor, Essex. And now all 3 local member of parliaments have sent letters to the federal government asking for stricter protocol around the border. Here's what we can tell you from Brian Massey. He's the NDP MP where the Ambassador Bridge and Detroit Tunnel currently sit. He says that he's looking for heightened and expansive daily screenings, segregation to designated housing for healthcare workers away from their homes here in Canada, or requiring health workers to stay in the United States. Now, we just got a response back from the Minister of Public Safety, their office saying that they are continuing to review what procedures are currently in place. And all of this is happening as we get a better sense of what it's like for someone to be COVID-19 positive. In Chatham-Kent, they have 6 cases of confirmed COVID-19. I spoke with a man, Luke Davidson, who had traveled internationally, came back to Chatham, self-isolated, and then realized the symptoms showed enough that he needed to get a test. This is the message that he has for the people in the public today.
I would say take this as serious as possible. Please, honestly. Like I'm hearing that we have patients on this floor right now that aren't doing as well as I am. Let's not have you in that situation, or your family members, or someone who you may come in contact with, who you possibly spread it with. Please don't do that. Just stay home.
The major symptoms for him were that fever that people have talked about, the loss of smell, and the loss of taste. He's doing well now. That's the latest here in our community. Our viewers can go to cbc.ca/Windsor for more on these stories.
Thank you, Chris. Now, the United States has 160,000 cases of COVID-19. That's the most in the world. And the hardest hit state so far has been New York.
We've lost over 1,000 New Yorkers. To me, we're beyond staggering already. We've reached staggering. And the only point now is do everything you can to save every life possible.
In order to help clear New York City's hospitals for the surging numbers of COVID-19 patients, a naval hospital ship arrived today. The USNS Comfort will be ready to take non-COVID patients within the next 24 hours. It has 1,000 beds and 12 operating rooms. Also, an emergency field hospital is being built in Central Park. It's set to open tomorrow. There are more than 70,000 cases of COVID-19 in the New York, New Jersey, and Connecticut region, making the 3 states the epicenter of the U.S. outbreak. Coming up, is it time for everyone to wear face masks when going outside? We put that question to an expert next.
Don't miss the $1 million bonus prize in the Princess Margaret Home Lottery. A luxury condo at One Bloor, plus $25,000 cash. The $1 million bonus deadline is this Friday. Buy now.
Some medical experts are saying we should wear masks when we are heading out for essentials. But today, our Chief Medical Officer of Health said he would not support that because it could give people a false sense of security, adding that he would much prefer that 2 meters of physical distancing over masks. Microbiologist Professor Dasantila Golemi-Kocha from York University joins us now. Professor, let's start with your take on this. Should we be wearing masks in public or not?
So, considering the scale at which this COVID-19 pandemic is going through, I would recommend or suggest, or it is my opinion rather, that wearing a face mask can help, especially individuals that are asymptomatic, they don't show any signs of infection, do not spread the virus. But also individuals that are at high risk, for example, elderly, or those that are immunocompromised, have another means of protecting themselves from receiving these droplets that can carry viral particles. So, but having said that, an individual wearing a face mask is not totally protected by the virus if that individual, for example, goes to a grocery and comes back home and doesn't wash the hands. So again, a face mask should be seen as another way, an additional way to protect us, to protect those that are infected, to protect from spreading the virus, but also those that are not infected, that they don't know whether they carry or not the virus.
Do you think folks, doctor, are being discouraged from wearing them, though, because there's an urgent need for surgical masks in hospital? Is this more about supply and demand, why we're not all being told to wear them at this point, do you think?
There has been suggestion in online, actually, that this could be a reason. But again, I do believe that doctors and experts like myself and others have in their minds to provide the correct recommendation for the people to be protected. So I'm hesitant to sort of make it that conclusion. At this moment, the rate at which this virus is spreading and how serious it can be, any protection, no matter how small it is, I think it should be recommended to use.
There are many concerns about hospitals facing a shortage of personal protective equipment during the COVID-19 outbreak. But could 3D printing and crowdsourcing be part of the solution?
This is the part that's actually 3D printed. It's actually very minimal. There's not much to it.
Sean Lim is a Toronto robotics engineer. He designed a visor that actually uses page protectors as masks. That design has now been approved by Michael Garron Hospital. They are now asking anyone with a 3D printer to help them print and deliver 10,000 visors. Lim says it takes him 13 minutes on his printer. If you'd like to help, the plans are now available online at theppedrive.com.
I wanted to bring a certain level of humanity to this crisis.
After the break, honoring our frontline heroes, plus details on how you can nominate one of your own. We'll be right back.
I wanted to bring a certain level of humanity to this crisis and put a face and a quote behind some of the people that are both directly related to healthcare and more peripheral to healthcare. It's been amazing hearing people's stories, from the pharmacy clerk to the screener, which is a totally new job, the barista and the janitorial staff, seeing how they're framing it and how it's impacting them, and just making a genuine human connection with people, I think has been helpful both for me and for the person I'm speaking with. As far as healthcare heroes, I have a lot, but someone that comes to mind immediately is Dr. Jane Philpott. I've never met her personally, but she's a family physician and former Canadian health minister, and she's currently back working on the front lines, helping out, working in the clinics, and she's been a huge advocate for communicating what should go on and what the appropriate response from the government should be. Seeing her come full circle has been inspiring, and she's the sort of person that does the right thing and does not apologize for it. So thanks, Dr. Philpott, and you're my nomination. We can get through this together if we all stay together, so thank you.
Thanks, Dr. Philpott, and thank you for everything you're doing, Dr. Moonen. If you'd like to share a story about your frontline hero, send us a selfie-style video explaining why they're also a hero on these front lines as we fight this pandemic. That is it for us here at CBC Toronto News tonight. Thank you for joining us. We will see you back here tomorrow.